Hey guys, what's up? It's me, Princess Ricky, and welcome to Surgery Squad. As you guys may be aware, I used to have braces myself. No, that's the wrong angle. Yeah, I thought it'd be a pretty cool game. I haven't done any surgery games yet. So, let's get into this. By the way, first time streaming, while recording a game on the browser. I just really hope this works. I'm a noob when it comes to technical stuff. Just saying, guys, I do this on my...
Welcome to Surgery Squad. I'm Dr. Jeff, and today we're going to talk about
Hi,
braces,
Jeff.
those fantastic bands and wires that help straighten out crooked teeth. Let's face it, most of us do not have perfect teeth. Everyone's smile is unique. Some people's teeth are just a little more out of shape than others. Your teeth might be crooked, or your upper and lower jaws might not be the same size. If your upper jaw is bigger than your lower jaw, that is called an overbite. If your lower jaw is bigger than your upper jaw, you have an underbite. Sometimes your mouth is not large enough for all your teeth. That is referred to as overcrowding. In all of these cases, the problem can be fixed with braces. Braces are a series of brackets, wires, and bands that are used to guide your teeth back into the correct position. This improves looks, makes it easier to chew, and at times even improves speech. Our patient today has what looks to be an overbite. We want to see how noticeable it is. We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs. We'll start by taking some x-rays.
Her teeth look more or less okay anyway. Alright, so I need to lodge these things in your mouth. Go ah! Okay. Give you a little dimple. I did it. Do it. Yeah. Smile pretty.
Next, we'll take an impression of the teeth. We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake. Can you put the mold in the mouth?
Jeff, stop lying. It tastes horrible. You're sitting there like gagging. Oh, I'm so sorry. I'm going to call you Linda. I'm sorry, Linda. You look like Linda. Sorry, Linda. They look like you're sucking a dummy.
Great job. We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth.
Ooh.
Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place. Our patient is back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth.
Oh, God.
Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
Okay. I'm sorry. I hate this noise. I remember what this sounds like and what it feels like on teeth. It's horrible. Go on, do it. Do it. I'm not doing it. Do it. Do it. Come on, I'm clicking. Come on. I'm doing it. I just got to click the teeth individually. And then that took like forever. Fuck it, I'll make the sound effects. I hate this. I hate the noise of it. I don't get why it's not doing it. I hate the noise. Like, it makes me cringe just thinking about it. Right, continue. Continue! Right, and I've got to hold it. Come here, I want to hold you. Let me hold you. Click here when finished. I'm finished. Come on, Dr. Jeff.
Wow, what a marvelous job.
Yay.
I can almost see myself in those teeth. We need to put on some molar bands to anchor the braces. They circle the whole tooth and have a hook on the outside of the tooth. Slip the molar band over the tooth. We'll cement it into place later.
Okay, so we're putting elastic bands in your gob. We're going to play a little banjo. Twang, dung, dung. Oh, these are little blue rubbery things. These are horrible. I remember they put it on me, and it's like the back molars. And the guy was so rough. He just literally shoved it down. I literally thought, oh great, he's knocking my teeth around. If he's watching this, not that I'm complaining. Trust me. Oh no, it's not. I had little blue separators. They had to put separators on so they could put those on my teeth. The separators are horrible.
Great. Now we can start putting the bonded brackets on the rest of the teeth. We've placed a lip guard over the teeth to give us room to work. Let's rinse off the teeth. Can you spray them with water? I run the suction to remove the water.
It's Talisa. Bob. I can't remember them putting that around my mouth. To be honest with you, I think I probably would have laughed. It kind of looks like a urinal. I'm doing it. Why ain't it working? Come on. Let me fill you up with water. Come on. Yay, the mouth is getting full, I think. Is that getting full? I think that's water. Yeah, I see some water. It's working. Oh, one thing though, if you do have braces, never do, lick your tongue over it. It bloody hurts. Especially, when your brackets are a bit loose. Done it. Dr. Jeff, I'm pressing continue.
Let's spray some air to get the teeth nice and dry. Can you handle that for me?
No. What's that supposed to mean? I hear it's not doing the sounds. I know I'm recording it differently, but God's sake. Oh, I hate... Oh, just picturing the sounds now, I'm like... Yucky. Oh, it's gross. Okay, I'm finished. In case you guys are wondering about my disappearance, I stopped recording for a little bit. I had a cold and fully lost my voice from Friday onwards. So I was a bit like, oh shit.
With the teeth dry, we'll now put a small amount of bonding agent on the teeth.
Ooh,
Wipe a little bonder on each one.
Ooh. One. Wait, what do I do? I'm right, I have to give you a little wipe. Well. Come on. I'm bonding. I remember when I played this last night, it came up orange when I clicked the teeth. But I can't play this through my browser. I'm having to do interactive browser through OBS. And this isn't working right. Because it comes up orange colour. You guys can see I'm definitely pressing it, look. Come on. Dr. Jeff. Alright, I think next time I'm going to record this differently. I don't think this is working. Oh well, it's content. Still use it. Ricky's fuck-ups. Next up on Ricky's fuck-ups.
We let the bonder dry for a minute or two so that it is sticky.
Orange. Told you
then
guys.
We place a bonded bracket onto it.
This ain't gonna let me do it either, is it?
I will scrape off the excess bonding agent with a dental pick. Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light.
Right. Zap. Oh, it's actually... Oh, it's the noises again. So it does work. Oh, it sounds like an X-ray. On the MRI machine. Oh, this is just going to be a video of me squirming and twitching. I don't remember this bit. Wait, yes I do. They put lights on your eyes. No, they don't put lights on your eyes. They put sunglasses on you. God's sake, brain. You in there, little buddy? I'm done. I'm pressing continue. I'm done. Dr. Jeff. Doctor! Stop bibbing at me. I'm finished. I'm pressing continue.
Great job. Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket.
I was brushing my teeth.
Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place.
It was like dangling up there. It hurt my lip. It was really sore. 1, 2.
Good job. We do not want the wires to poke our patient. So now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band.
I was boring.
The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
Alright. It's gonna take me ages. Come on, I'm doing it. Really, it lets me do the light, but not this. Come on. Oh, come on, come on. Do the record motion with me. You gotta swing your hips now. Oh, God. And this is why I've only got 74 subscribers. Come on. Come on. Yay, I done one. I'm so proud of myself after 100 clicks. Oh, I done 2. I hate the noise. It sounds like someone's got gas. Oh. Yuck. I've got like a bad romance stuck in my head. Oh. What the hell's going on with my life? What is my life? Oh, please stop. I don't like it. Oh, I hate it. Oh, please don't. It sounds like someone's like blowing up a balloon and then stretching it, like making a balloon animal. Oh. Come on. Come on, you let me do the top, John. Let me do the bottom. Let me... Come on, let me put my rubbers on. Come on. Work. Work. I can't get it on. Great, now it's Spice Girls. Because tonight is into. Sorry, my dog's giving me evils. That's my dad flushing the toilet. So classy. Sorry guys, just communicating to my dad. I used the wrong hand, I should have used my other hand. Because this one shows up on screen. But on that you can't tell. Oh yeah, you can. Ricky learning how camera angles work. Ooh. Come on, one left. This is tedious. Stop being so tedious. There we go. Linda. It was Linda, wasn't it?
And with the last ligature in place, our patient is done for today.
Linda.
In the next few days, she might experience some initial discomfort.
You look like
she should
you've
plan on
aged
eating soft
terribly.
foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist. It is important to take more time brushing and flossing when you have braces, as food can get lodged between the wires and the teeth. Our patient will have regular appointments about once a month for the next 6 months, and then space them out after that. The treatment usually takes about 1 year with braces, and then additional time with a retainer.
I remember that.
The
I think
true
I had
length
mine
will
for about
vary
2
by
years, so I
patient.
had like plastic blocks.
She might also need
bypass.
additional equipment such as elastic bands,
that.
coil springs, or headgear. We will not know until we see how she
Headgear.
responds to the braces. There you have it. The braces are in place, and our patient is on the way to a
Yay.
beautiful straight smile.
What should we do next?
Thanks for coming by Surgery Squad. Why not check out one of our other procedures
Alright,
here on
someone had a sore throat. Why don't we do
surgerysquad.com.
tonsiloscopy? Tonsillectomy. Come on. Do tonsillectomy? If not, I'm going to have to edit this again. You're not going to let me do it this way, are you? Alright. Give me 2 seconds. My people. No. Okay, just copying the link over. How much technical stuff? Alright, the screen should change in a matter of seconds. If I've done this right. I really hope I've done this right. 3, 2, 1. Yay, I did it right. Nice ear. Quite proud of my little self. Here the game. That's a tiny window. Oh yeah, I forgot the window gets bigger. Brain. Start.
Welcome to Surgery Squad's virtual tonsillectomy surgery. I'm Dr. Jeff.
Hi, Jeff.
Today we'll be removing a young man's tonsils.
Oh, joy.
This is a common operation that's performed when a patient suffers from frequent bouts of tonsillitis.
I didn't have tonsillitis.
It's most often performed on younger patients, but adults can need it as well. The tonsils are located at the back of your throat on either side of the uvula.
They look like your
That's the
kidneys.
little punching bag thingy that hangs down in the middle.
I remember at
Tonsils
Monster
are
House, they were
infection
about, oh, it's a
fighters, but
uvula.
occasionally they lose the
And,
fight and
little
get
kid goes,
infected
"Oh, so it's a
themselves.
girl house."
They become red
Got
and enlarged
confused
and can
with,
sometimes make
the
it hard
vagina.
to breathe and swallow. Normally we treat this with antibiotics, but when tonsillitis reoccurs frequently, we remove them because the infection can cause more serious damage. Our patient was given a sedative before being brought
Yeah,
into the
it's just
operating
good.
room,
There we go.
and the anesthesiologist will help put him completely under.
Oh, God.
Help me out and place a breathing tube in our patient's nose to assist with breathing while we operate.
Let's message someone. Sorry, I'm just got friends messaging me. Alright, what am I doing? I've got to shove it up your nose. There, one. Come on, get up there.
We need to get our patient's mouth open wide so we have room to work. To do that, we'll use a special mouth gag retractor that opens the mouth, depresses the tongue, and locks into position. Why don't you take a crack at that?
Go for me.
Great job. That should give us plenty of room.
Oh, that looks horrible.
Now we have to reach in and grab the infected tonsil with the tonsil forceps. We need to pull it to the side to expose the connective tissue. Can you do that for me?
No. Please, Jeff, don't make me stop. I don't want to do this. Dr. Jeff, I'm having some grabbing problems. Dr. Jeff. Dr. Jeff.
Nicely done. With the tonsil extended out, we need to place this electrocautery device at the tonsil's base. The device uses high-frequency current to cut away tissue and seal off the blood vessels at the same time.
You're going to feel a slight pinch. Slight burning smell.
By removing the tonsils this way, we reduce bleeding and allow the patient to heal faster. Now that the tonsil has been cauterized, we reach in with a tonsil guillotine clamp. The clamp severs the last of the connective tissue and allows us to remove the tonsil from the throat. Clamp the tonsil and pull it out, would you?
No. You do it. You're a doctor. I'm having a problem clicking. Hey, it's still...
We'll bring the electrocautery device back in here and apply it to any bleeding areas.
Psst. Psst. Come on. Psst.
Because this part of the throat heals quickly, we won't need any stitches.
Yay!
Now we repeat our steps on the other side of the throat. Extend the other tonsil with the tonsil forceps. Just like the other side, we'll cauterize this tonsil to release it, while keeping blood loss to a minimum. And finally, we need to remove the tonsil.
Oh, God. I'm clicking it.
And don't forget those bleeders.
Bleeders. Go fill us up, my lord, you bleeding kids.
I'll clean out the mouth with some irrigation and suction, and then we're all done.
Good for you.
We'll send our patient to recovery for 8 to 10 hours, and more than likely he'll be able to go home later today. Once he's sent home, our patient will be put on a course of antibiotics. He'll need to keep hydrated with cold water or sports drinks. And if he gets hungry, he can have cool, soft foods like fruit pops, gelatin, sherbet, pudding, and of course, ice cream. Getting a little hungry? Thanks for stopping by SurgerySquad.com. While you're here, check out some of my other spectacular surgeries. They'll always stand the test of time, unlike my hairline.
I like my hairline. Jeff, are you balding? Alright, let's do one more surgery. Oh, God. Right, guys. Why don't we do... Fuck it. Alright guys, we're going to do hair transplant procedure. Seeing Dr. Death. Dr. Death? Oh god, we've got Dr. Death now. But there was actually a doctor called Dr. Death, wasn't it? He was going around killing all his patients. I watch weird crime stuff. Alright. This one we'll do receding the hairline just for Dr. Jeff. Well, not, what's it called? Hair transplant. Okay. There. I did it. Hey, look, Ma, I made it. God's sake. How are we doing? What that? Start.
Welcome to Surgery Squad's virtual hair transplant. I'm Dr. Susie, and I'll be assisting you with this surgery today. A hair transplant is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body, known as the recipient site. Although hair transplantations are typically used to treat male pattern baldness and restore eyebrows, beard, or chest hair, they can also be used to fill in scars caused by accidents or surgery. Today, we'll be using the strip harvesting method to treat our patient's male pattern baldness. Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids.
So basically,
alcohol use and smoking before and after the surgery can also result in poor graft survival. To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help prevent any infection. I think you can handle that.
You don't sound as bossy as Dr. Jeff. I like you. I'm prepared to be amazed. Come on. It's a horrible noise. Is it even come out? I got a blob. Blobby, Mr. Blobby. Click and drag. I'm clicking and dragging. I'm doing shite at this. I'm holding like right. I think I'm gonna get a mouse for the laptop. Because this is really difficult doing it on the sensor pad. Because at the minute it's only squeezing it out when I press. When I tap the sensor pad. Oh wait, I'm getting there. Looks like I'm drawing a weird face. Like the top bits are the eyebrows, and then here we got the eyes. Come on, I'm doing a face. Are we doing my face? No, Come on, come out. I think we're running out of shampoo, Susie. Okay, get the shoulders. Here we go. It's working. I'm shampooing. Yay. That sounds so optimistic then. Yay. I'm doing it. Look, Mum, I'm doing it. Okay. Sorry about your head, dude. Mike. Susie, I'm finished. Click and drag. I did. Oh no, you want me to rub it in. Alright, Susie. Dude, you look amazing. You look like you've got a lot of snow on your head, either that or you're just growing a white afro. Actually, kind of looks like little leaves. There's snowy leaves at winter time. So I don't get snowy leaves, because leaves die off the trees. Oops. This has been
so fresh and clean. Thoroughly rinse the patient's hair, and we're ready to get started.
That's been annoying me the whole video. I don't even know what it is. God's sake. Okay. What's this? Oh no, it's a hose.
The next step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
Oh dear. And the water's still running. Susie, we're going to have a flood. I'll do one line. Thank you. So let me start here. Wait, how did I do it last time? So let's hold this bit. Hello, I'm drawing. I'm drawing. Let me do it. Oh, here we go. I'm sorry. You're losing part of your hair too, according to this. Oh dear. Here, let me sign your forehead. Damn it, I can't sign your forehead. Okay. Finished. Susie? Susie?
That looks good to me.
Oh, your head.
Let's prepare the donor site. We'll begin by trimming the patient's hair in that area.
Elastic band. Oh god, I've got to give him a haircut now too. Okay, Susie. Mike, I'm sorry. Mike, you're gonna end up getting a really bad haircut. Oh dear. I'm so sorry, Mike. I hope I'm cutting the right bit off. I get rid of the top bit. Oh crap. Sorry, Mike. I think I'm done.
Now that the patient's hair is trimmed down, we'll need to mark the area that we'll be removing.
What? Oh no. I don't want to cut his head open. Don't make me do this, Susie. Not only would he be pissed that, you know, like he's losing hair. Come on, let me draw. No, I don't want to move the page. Thank you. I want to draw. Let me draw. We draw at noon. No, I'm kind of in your head in. Come on. You can lay your head in. Susie, your pen's run out. We can't do it. Susie, you do it. This pen's dodgy. Susie! Dr. Susie.
Great job!
Thank you.
Inject local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience.
God's sake. I'm sorry. I'm sorry. I'm sorry. And the shape on the back of your head looks like a banana, and I'm sorry.
Great! He won't feel a thing.
Oh, that's
Now we'll need
nice.
to remove the piece of scalp we outlined from the donor site.
I don't want to
Use the scalpel and cut along the line to begin the process.
Using scalp on a scalpel. I mean, the other way around. Okay. Sorry, Mike. Beauty's pain, Mike. You know what they say. Oh. I'm doing it. Yeah. I can go it down for you guys to see my mouse, but I should have actually. You still need to see I'm actually trying it. I'm not just sitting there like. Come on. Oh, we're doing it. I'm carving it.
Next, we remove the piece of scalp from the donor site.
Can we not,
Make
Susie?
sure you have a good grip.
Susie, can we not? Please, Susie. Oh, it's coming. I lost it. Come on. Oh, God. Mike, yeah, I can see your brain. Oh.
Once removed, we'll prepare the piece of scalp for grafting by dissecting the individual follicles. But before we do that, why don't you go ahead and suture the donor site?
No. How about I don't? How about I run away? I wanna run away. Dude, they're turning you into Frankenstein. Run. Mike, run. Warn your friends. Okay. I still got to stitch your head up, for God's sake, Mike. Stop having such a big head. And in your hair like that, you look like Jed would. Apart from they don't have the stitches. Or sutures. I think sutures are the ones that dissolve. You don't have to have them removed. I think. Like butterfly stitches. But no, but they peel off though.
Great, let's get to some dissecting. The first thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others. Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor.
You're kidding me. Ugh. Seriously, it's hair by hair?
Nice job! This step is repeated thousands of times to get each follicle prepared. I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the scalp. We don't want our patient to be uncomfortable.
No. God knows, because we've already done so much.
Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp. Use the microblade to make the incisions in the recipient site.
I don't want to. Susie, you're scaring me. Oh. Susie, I feel like I'm playing bingo dubbing.
Perfect. With all of the incisions, it's getting a little messy there. Let's get that cleaned up.
Really? It's easy like Sunday morning spring cleaning. I missed a bit. I didn't get that bit. It's a big bit. Mike, sorry, I just stabbed you in the head a few thousand times. Ugh. Right, Susie, finished. Susie. Susie.
Much better. Use your tweezers to pick up and insert the hair grafts into the recipient area.
Uh-oh. You're kidding me, right? Look how long this is. Don't make me do all this. I ain't got the attention span for this. It looks like he's been growing cress.
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site.
I'm not, you can.
After the procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections. For up to a week after the procedure, the donor area may be sore and some numbness may be experienced as well. Our patient can also expect moderate swelling and redness during this time. Shampooing of the recipient area is typically started 2 days after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost. In about 10 days, our patient will return to have his sutures removed.
Hello.
During the first few days after surgery, almost all of the transplanted hairs will fall out due to shock loss. Shock loss occurs when the hairs are traumatized by their relocation. Within 2 to 3 months, the patient can expect new hair to begin to grow from the treated area and continue to thicken during the following 6 to 9 months. And that's hair transplant surgery. Why not try your surgical skills in another surgery here on surgerysquad.com?
I think we're done for today. Anyway, guys, if you like this video, don't forget to like, comment, subscribe. I've been Princess Ricky. You can follow me on Twitter at princess_Ricky1. And I'll see you guys in the next video. Goodbye.